not hocus pocus or magical.
Aspirin was a complementary alternative medicine.
The consumer need be aware, and in many cases greatly aware.
The problem again with eggs, though, is the yolk is 215 milligrams of cholesterol. That's like an 8-ounce steak.
The needles feel more like a warm sensation.
You've got heart disease, we can operate or you can die, that's the choice.
They say that this is different from traditional medicine, but in actuality, this was the traditional medicine.
It definitely has a unique aroma and a unique taste.
I was in pain. I wanted out.
We're in a crisis when it comes to health.
Beware of charlatans.
Holistic Health from Hawaii is made possible in part by support from the Office of Economic Development of Maui County. Additional support provided by the Hyatt Regency Maui Resort and Spa at Ka'anapali Beach and from the Hyatt Regency Waikiki Resort and Spa.
Hi, and welcome to Holistic Health from Hawaii. I'm Emerald Ye. We're here on the island of Maui, a natural place to be actually, to talk about health and wellness. Not only does Hawaii lie halfway between Asia and the mainland United States, it's also become a kind of east-west bridge between modern Western medicine and traditional Eastern medicine. Western medical practice mainly fixes health problems after they've occurred. Holistic practice, or complementary and alternative medicine, focuses more on preventing disease and maintaining wellness. In this program, we'll give you an introductory glimpse into wellness remedies. We'll try to separate the hype from the reality as we look at a variety of unconventional approaches to health care, including mind-body medicine, energy therapies, and dietary treatments. We start with an ancient Chinese practice that's used for pain and healing. Stuart Chaffee has that story.
Up here, Alan. It's like getting a fish on.
Perhaps the procedure which best represents the confusion surrounding alternative medicine is acupuncture. It seems clear that it works for some patients, yet it is difficult to explain its medical effect in usual scientific terms. And sometimes the explanation of acupuncture is downright bizarre.
You have a TV antenna on top of your house, or maybe a dish or a satellite. And that picks up a signal coming from Mount Haleakala, maybe from Honolulu, maybe from a satellite. But that antenna is taking in the signal and bringing it in, so you're then watching it on your television. Okay? Same thing with acupuncture. The needle is the antenna. It's pulling in chi from the atmosphere and bringing it into that acupuncture point. So that acupuncture point can open or close. It can fill up, or it can spread its chi into where it needs to go.
That may not be a convincing explanation for how acupuncture works, but Western-trained medical professionals have observed its positive effects.
I have used acupuncture, and I have watched acupuncture used. I've watched in China acupuncture used for painless labor and deliveries. I've watched appendectomies done with acupuncture without additional anesthesia. I have watched it used, I've watched moxibustion used to rotate fetuses. I have seen many of these things in technically very competent hands, and I believe we have a great deal to learn.
Acupuncture did not evolve from the usual scientific laboratory studies, but rather from the common experience of everyday people in China.
For example, just through the life experience, some people, if they use like a stone, very sharp stone, to press some body's point, then they feel, oh, can reduce my pain. So through this experience, then the people first use the stone. They tried to make the different shape. And very original, the needle actually we made from the stone. The stone needle, they made it very fine to press or insert
The most usual application of acupuncture therapy is in treating pain.
Pain is where acupuncture has been primarily studied. Pain is where the American Medical Association and conventional medicine has looked to assess and evaluate acupuncture as being a viable healing option. So when attention goes to acupuncture, particularly within conventional medicine, it usually is primarily associated with pain-based management.
But the view of acupuncture as a treatment modality gets a little sketchier when people claim it actually cures disease. This patient is getting acupuncture treatment for his diabetes. Acupuncturists believe that while Western medicine attempts to cure disease with drugs, acupuncture can help the body heal itself.
Western medicine is an injection, but we do use certain points and who related to, like to restore the function of the body to produce the insulin. We do research. We do think, oh, we treated the lung, treat the stomach, how can match it to? We do think we use a certain point, we can induce the body itself to produce the insulin.
But there is no evidence that acupuncture is an appropriate treatment for a disease such as diabetes. And in fact, it may be harmful to the patient.
Acupuncture, as far as I know, doesn't cure diabetes. But acupuncture cures or ameliorates a lot of things. I mean, pain, distress. I mean, but it as far as I know, it doesn't cure diabetes. So that's a perfect example. If a person who has diabetes who's taking insulin says, you know, the acupuncture will cure my diabetes, and I'm going to not take insulin anymore, then, you know, that person is going to be in diabetic crisis in a few days.
Acupuncture is used to treat trauma as well as disease. This patient was in a bad car accident. She tried the usual Western medicine treatments, but nothing seemed to help her until she went to an acupuncturist.
A car hit me from the side, so all this entire side of my neck had an injury. This was almost a year ago. And I tried a lot of basic, regular medical therapies, and they just prescribe a lot of medications and things, which is what they do best, and some physical therapy, but it wasn't really giving me the relief and comfort and recovery from the pain that was involved from the neck injury. All that soft tissue injury was the real problem.
There are endless stories like this.
One patient had the car accident 4 years ago. And now she cannot, when she come here, she even cannot walk by herself. It's the lumbar spine, the dysfunction. So she walking with the things to help come. And her doctor always hold her. She suggests the doctor say, can I try the alternative? Say, no, doesn't help. So 4 years, this patient is suffering, you know. So she come here to see Dr. Zuning, and by patients referred to here. So I tried. The only one time she said she slept, she feel energy, like energized. She's so happy. Today, she just walk without. I will show you that lady.
So the question again is, why and how does acupuncture work? The ancient Chinese theory is that there are meridians or energy flow lines in the body which more or less correlate to the nervous system and the circulatory system. What an acupuncturist does is insert needles into these meridians to realign the energy flow, the qi, and bring the body and its organs back into natural, healthy balance.
We do believe the body have the free flow of qi and blood. Qi is some kind of energy, and blood is like nourishment. So we do think the body, if we want to keep the healthy condition, have to be free flow of qi and blood. The balance, we see, have to keep the harmonious and the balance of the body.
It is clear that the interest in acupuncture has been growing in the United States ever since it was introduced here about 30 years ago. And according to Xiaoqing Yang, it's become more popular simply because it works.
Nowadays, people try alternative medicine. They do get the benefit. So then they tried to learn this kind of culture, medical culture. But I think the main reason is help people. And the acupuncture works very well on the patient. That's the real reason.
It's hard to explain acupuncture without also talking about qi, that mysterious energy force. As we've already seen, these two concepts are very closely related.
Before we deal with any kind of adjustment technique for the purpose of aligning. Qi is a Chinese term, qi, often described in the Japanese tradition, mana in the Indian tradition, is a description of energy, an energy that can be defined in terms of sensation or be undefined in terms simply of the awareness of energy that moves through an individual's body.
Qi is different from Qigong, the practice of working with Qi. When we talk about Qigong, practically, there are two aspects to it. One is the healing practice, the other is the exercise regimen. The exercises involve a series of disciplined body movements which are supposed to heal various parts of the body.
First, the back, so that the back of the lungs are open. And then when we put our arms up, we stretch the lungs up. And when we spread out, we stretch the lungs sideways, horizontally, so that what is happening is we're trying to enlarge the lung capacity. We're teaching the students also breathing, so they are breathing in oxygen to expand those lungs and massage the lungs. And then when we bring our arms back and forward, we are taking out the negative qi that's stored in our lungs. So if you keep doing that, you will bring in good qi and expel negative qi.
As with acupuncture and meridians, Qigong exercise purportedly adjusts energy flow in the body from the feet up to the hands.
The hands, we were keeping qi in our body by keeping our fingers closed this way, and we were squatting. And when we squat, we sent the qi down into our large intestines. And then when we came back, relaxed, the negative qi came out of our hands, fingers, and our feet. And this is very good both for respiratory ailments and for people who have stomach, large intestine, colon problems.
The other aspect of Qigong is its use in clinical diagnosis and the actual healing of specific maladies. It involves an analysis of the body's energy flow, in which the practitioner mentally scans the patient's body and then marks down those areas in which there is blocked energy. Once again, it's hard to explain how Qigong diagnosis works in usual medical terms.
I'm not a doctor, first of all, so I really can't explain exactly what's happening. I only can tell you what I sense, and that's very difficult to explain. But what I'm doing is I'm trying to feel Angela's energy and where there are blockages. And if I concentrate on that and clear my mind, then my hands begin to move toward the areas where Angela's blockages are, and I mark those.
The other mysterious part of Qigong is the actual healing and the use of the hands, sometimes not even touching the body.
Well, I was smoothing the energy, bringing the energy down sometimes that needed to go down and out of her body, and that was what I was doing.
As with acupuncture, it may be hard to understand the science of Qigong, but it's not hard to believe the patients who say they have benefited from it.
I have a defective heart valve, so the blood doesn't flow freely throughout my heart chambers.
As most patients do, Roland started out his search for treatment by going to a traditional Western doctor.
Well, basically the doctor said, you know, you just live with it, there's nothing they can do for me. And I had gone through infectious disease specialists, internists, took echocardiograms. I went to every so-called healer around, and I just got discouraged and depressed and said, well, okay, that's why I resisted so much when my cousin said, you have to come see this guy.
This guy was Qigong master Hong Liu. Roland was reluctant to see him, but he changed his mind and made an appointment.
The night before I was to see him, I went on my computer and I typed out every single thing that was wrong with me in my body. So I went to see him. His translator was in the restroom. He didn't speak English. I don't speak Chinese. He glanced at me. He shook my head. He went to a table, pulled out a paper with a figure of a man, pulled out a red pen and started marking his figure. And I looked at it. Everything he had marked was everything on my list. So I said, wow.
Joyce Settle, who is now a Qigong practitioner, got into the field because of her experience as a patient of Master Hong.
I had some problems. I had the beginning of arthritis, a start of scoliosis. I had very bad back problems and knee problems. So I decided that unless I did something, I would end up being an invalid and a burden to my family.
So Joyce sought out a variety of Western doctors, none of whom helped her.
But it wasn't until I found Qigong that everything was brought together. I felt as if not just my body, but my mind, my whole spirit, spirituality came together, and I could feel health coming from the inside of my body and reflecting out. So when people saw me months after that, they'd say, "What are you doing?" And I felt like that's the proof.
But not all patients respond to Qigong treatment, and when they don't, the practitioner's answer is often that the patient didn't really want to get better.
I have seen people where Master works on them, they really don't want to get rid of that pain. I mean, verbally, they're saying they do, but deep inside, something is making them feel that they need that for some reason in their lives.
Despite the heavy emphasis on the mental aspects of Qigong and the apparent importance of the placebo effect, there appears to be some science supporting the medical effectiveness of Qigong.
Qi is not hocus pocus or magical. It is very scientific, and it's based on scientific principles.
I think there's something there. I think there's something there.
Can you go beyond that?
No, because I think, highly respected physicians have come to me and said, hey, this guy's for real. This guy's for real.
The #1 killer in the United States is heart disease. And for people with heart illness, that means major surgery, a lifetime on expensive drugs, or even worse, death. But there is a natural way to prevent and even cure heart disease. And that's the focus of our next story.
Maybe help them with themselves and their families to learn about eating much more healthfully.
Most people only start to think about health care and medicine when they get sick. Of course, a better strategy is to always think about your health and avoid getting sick in the first place. Two of the most important aspects of staying healthy and avoiding illness are lifestyle and diet. Nutritionists say a good diet will help you stay healthy, while a bad diet is a formula for disaster, and most of us are eating a bad diet.
We're in a crisis when it comes to health, and part of that is because we're eating the wrong types of foods. Normal food is fruits and vegetables and whole grains and beans, the foods that we're designed to eat. We're actually, most people eat abnormally. And that's the reason that about 70% of the people that we have in our hospital today, like here at Castle Medical Center, are there because of their diet and their lifestyle. Heart disease is the #1 killer. Then comes cancer. And a lot of that has to do with the foods that people are eating.
The good news is that a healthy diet, a very healthy diet, can reverse the illness caused by bad diet. The leading proponent for reversing heart disease through good diet is Dr. Dean Ornish.
Well, for the last 25 years, we've conducted a series of studies demonstrating for the first time that even severe heart disease can actually often begin to reverse when people make bigger changes in diet and lifestyle than had been previously recommended. And the premise is that your body has a remarkable capacity to begin healing itself, and much more quickly than we had once thought could be done, if you change the underlying causes of the problem rather than just literally or figuratively bypassing them.
While many traditional medical interventions seek to address only the symptoms of heart disease, good diet can actually cure the disease in a measurable way.
One of the nice things about heart disease is that the technology for measuring it is so advanced. You can actually measure the blockages or the plaques in the arteries. You can measure blood flow to the heart. You can measure how well the heart is pumping. And we found that within a few weeks, most patients became essentially pain-free. Even those who literally couldn't walk across the street without getting severe chest pain, we were essentially pain-free within just a month or so. But they not only felt better, in most cases they actually were better in ways we could measure.
Dr. Ornish has worked with thousands of heart patients, and many of them have become living testimonials for the Ornish diet.
One day I was at the theater and I ran across the street to get a snack, and an elephant sat on my chest. I just got this enormous pain. I went to the doctor and he gave me the various tests, a treadmill, and wound up with an angiogram which showed that I had 100% blockage in my right main artery and 90 and 85% in my left main arteries. And I was told by 4 cardiologists that if I didn't have a bypass operation immediately, I wouldn't live out the month.
Surgery seems like a quick fix, while diet and lifestyle change seems like a slow process. But Neil saw results almost immediately.
When I started it, I had a cholesterol of 372. It's 113 now, which is, I lost 40 pounds, 7 inches off my waistline. Felt good. 7 months after I started it, I finished in the middle of the pack of the Great Aloha Run, an 8.2-mile run, and I knew I was in good shape.
Neil is rather proud of the fact that his approach to treating heart disease proved to be more successful than the bypass surgeries done on many of his friends.
Well, I know that of the people who are my contemporaries who had bypass surgery and had bypass surgery again since then and have had angioplasties and are still not feeling well, and you know, I've outlived 3 of the 4 cardiologists who are younger than me who told me that the program wouldn't work.
While Neil Pinckney's recovery seems astonishing, Dr. Ornish says his experience was not atypical.
No, it's not. In fact, part of why I'm so passionate about doing this work is over the last 25 years, I hear story after story like that. That people who literally couldn't walk across the street without getting severe chest pain within a month are essentially pain-free. We found overall a 91% reduction in the frequency of angina or chest pain in all the patients, and most of them became pain-free within just a month. Within a year, you know, one man, for example, was climbing 130 floors a day on a Stairmaster who couldn't walk across the street without getting severe pain.
One of the first patients to try the Ornish diet for reversing heart disease was Don Vopel, a psychologist at the University of California in San Francisco.
I had a massive heart attack at work at 11:05 in the morning and was taken to UCSF, and they told me I had about 3 months to live and to go home and get my affairs in order.
Don went on the Ornish program and saw positive results in just 3 months.
My angina, and I had severe angina, went away within 90 days. And my overall health, I would say at the end of 9 months, when I realized I'd lost over 100 pounds, and I just had all of this energy and a new zest for living. I realized that this is something I could do. It was not hard to do at all.
Don not only felt better, tests showed he was better.
Through the course of the study, we had angiograms continuously. I've had about 14 of those. I just came back from my yearly physical in San Francisco, and I reversed heart disease approximately 88%.
For most patients with heart disease, the options usually given are surgery or medication. But Dr. Orner says not enough doctors tell their patients about the other options.
If I have a patient who has heart disease, I say, okay, you've got a variety of choices. We could arrange for you to have bypass surgery or an angioplasty. We could put you on medications, and or you could change your diet and lifestyle. And then we go the benefits and risks of all those different approaches. Now, if you take an evidence-based approach and you say, are there any studies proving that angioplasty, for example, prolongs life or prevents heart attacks? The answer is no. Those have never been shown, even though we spend billions of dollars on those operations. And if you say, what are the evidence looking at randomized controlled trials of bypass surgery, only a relatively small percentage of people has it been proven does it prolong life or prevent heart attacks, maybe 3 or 4%. Now, most people don't know that. They're told, okay, you've got heart disease, we can operate or you can die. That's the choice, as some of the patients in our studies were told. And yet, for most people, that's not really true.
Deciding against surgery not only avoids the possible complications of surgical procedures, but in fact, it increases the odds of survival.
We know, for example, that up to half of the bypass grafts have reoccluded or clogged up again within just 5 years, and a third to or more of angioplasty arteries have restenosed or clogged up again within just a few months. Whereas if you can change the underlying causes of the problem, which are really what we eat, how we respond to stress, whether or not we exercise, whether or not we smoke, and the quality of our relationships, that we can measure, ironically, using these very high-tech, state-of-the-art technologies, how powerful these very simple and low-tech and low-cost interventions can often be.
There's a certain inertia that keeps people eating what they've always eaten, whether it's good for them or not. And sometimes it takes a health crisis to change a bad habit.
I'm so glad you're all here.
For Rebecca Woodland Hawley, it took a bout with cancer to convince her to change her diet.
7 years ago, I had cancer, and I wasn't healing very well, and I had a really bad experience, and I never wanted to repeat that experience. And so in the process of trying to recover, I got some good advice along the way and did some research and found a naturopathic physician who recommended that I go vegetarian. But really, it was more of a whole foods diet, not just cutting out flesh foods, but eating more plants, beans, whole grains, legumes, things like that.
Rebecca now teaches classes on vegetarian cooking here at the Castle Medical Center in Hawaii. She says you shouldn't think of being a vegetarian as sacrificing the foods and tastes you love.
One thing I learned is the concept of sacrifice. We often think, especially when we're making a change in our diet, or we think we're giving up something that we enjoy, and we think that, oh, this is going to be a sacrifice, it's going to be really hard. But the dictionary definition of sacrifice is giving up something of value for something of a higher value. And in this case, that was my health, because without my health, I didn't have anything, I didn't have a life.